viruses mutate to extend their shelf life. The coronavirus causing COVID-19 has mutated into various variants like the Delta variant, Gamma variant, and the Beta variant. But do you know that the COVID-19 virus is still evolving further, creating variants which are as dangerous? On Health Watch, we take a look at variants and what it means on the fight to contain this pandemic. My name is Saada Hassan. Science shows that the more coronavirus circulates, the more chances it has to mutate and enhance its capability to attack the immunity of people. The World Health Organization adds that all viruses, including COVID-19, change over time. The changes may have very little to no impact on the virus's properties. However, some changes may affect the properties, such as how it easily spreads, disease severity, and how it responds to vaccines.
Almost 4 million cases were reported to WHO last week. And on current trends, we expect the total number of cases to pass 200 million within the next 2 weeks. And we know that is an underestimate. On average, in 5 of WHO's 6 regions, infections have increased by 80%, or nearly doubled over the past 4 weeks. In Africa, deaths have increased by 80% over the same period. Much of this increase is being driven by the highly transmissible Delta variant, which has now been detected in at least 132 countries.
Currently, there are different variants of COVID-19 across the globe, with some being classified as variants of concern, while others are variants of interest. WHO classifies a variant of concern as one whereby it shows an increase in transmissibility, records a change in clinical presentation, or decreases the effectiveness of public health measures available. Variants of interest are regarded as variants which are predicted to affect the virus transmissibility, disease severity, or diagnostics. Also, it is identified to cause significant community transmission with increased relative prevalence alongside increasing number of cases over time. There are 4 variants of concern, namely Alpha, Beta, Gamma, and Delta, while there are 4 variants of interest according to WHO, Eta, Iota, Kappa, and Lambda. However, new variants are coming in and raising concerns over their transmissibility and how they respond to vaccines, therefore moving from variant of interest to variant of concern.
The Lambda variant is one of several variants of interest that WHO is tracking around the world at the global level. As you know, we have 4 variants of concern. We have at least 4 variants of interest. We have 13 alerts that we're following, and we have many, many more signals that we're looking at. And what we're doing is the Lambda variant does have, it's known as C37. It is classified as a variant of interest. I was just checking our GISAID database, the online database, and looking at where this is circulating. It's been reported in more than 40 countries right now, but most of those reports of sequences that have been shared on GISAID report less than 10 sequences. And so it is actively being discussed as a variant of interest because it is being reported in a number of countries. But what we're looking at is how well it circulates, how much transmission takes off once the variant is detected. And in fact, it really doesn't seem to take off once it is reported in a country. Even in Peru, where it was first detected, reports from our PAHO colleagues actually state that the Gamma variant, the P1 variant, is outcompeting the Lambda variant.
Lambda variant is mutating further, but it is something that is still under observation.
There are several mutations in the Lambda variant in the spike protein. There are some amino acid deletions. There's a number of characteristics of it that cause some concern because, of course, any changes in the virus pose some threat to its ability for the vaccines to work. And so there are some studies that are underway. I think you're mentioning a preprint that was just released. This is some of the data, of course, that we look at with any of the variants of interest, the variants of concern, and quite frankly, any viruses that are being studied right now. So at the moment, we classify this as a variant of interest at the global level. It doesn't mean it is less important by any means. It is one that we are actively discussing, and we are actively trying to gather and garner as much information as we can from all available sources. But so far, this is where we are. It's a dynamic situation. The entire pandemic is a dynamic situation, and we discuss with our virus evolution working group, which is composed of virologists and bioinformatics specialists, epidemiologists, clinicians, to look at this data almost on a daily basis with our partners around the world.
Here in Kenya, the Delta variant was first reported in Kisumu around May 2021, raising alarm after cases had started surging in the Lake region. This later on led to stringent measures being put on 13 counties as a way to mitigate the spread of the virus.
We have detected 5 new cases that may be linked to the initial group of infections traceable to the Indian variant. We have confirmed that there are just 5 so far amongst that cluster of people.
A recent report from Kemri Wellcome Trust shows more cases of Delta variants are being reported in the country. According to the report, out of the 15 samples collected between 20th and 23rd July 2021 from Kiambu County, 7 turned out to be Delta variant cases. Kemri recommends that continued genomic surveillance ought to be done on samples taken in Kiambu County. The Lambda variant, which was first discovered in Peru, is now in more than 40 states, accounting for more than 1,311 cases of COVID-19. These variants are of interest to Kenya due to lack of stringent measures preventing air travel or border restrictions. This means that variants can move about or transmit easily. Here in Kenya, the return of public gatherings and matatu carrying at full capacity does not make it any better. Health workers say that they do not understand this at a time when there is a looming threat of another wave.
It's a decision that we actually do not understand. We do not understand who advised and how it came about. Because we cannot be in the middle of a fourth wave with one variant that is very infectious and very lethal, and one that progresses very fast. The disease that is caused by the Delta variant progresses very fast, meaning it can infect so many people and so many can be able to fall sick and require hospitalization. And you remember when we were starting all this, we were saying the reason as to why we are giving Kenyans these protocols is because we do not want a big number coming to hospitals because we will not be able to take it.
Kenyans have different views concerning variants of COVID-19.
What I know is, understand, is COVID came from China to the world. So the next one I heard was the Indian Delta. Of course, that came from India. That's the 2 variants I understand. So from the one from China, yes, the one from India.
Over time, knowledge and the impact of COVID-19 is clearer among Kenyans. However, some are still in denial.
Mama amekuwa mgonjwa kama 2 weeks before. Nimekuwa nikimwambia tuje hospitalini, naambia yeye haendi hospitali kuokota corona, atakaa nyumbani. Kama ni corona imkute nyumbani. Na sasa nikienda kumchukua mama nikakuta hali yake si nzuri, amekuja amepimwa corona, akapatikana corona. Namuuliza mama, siku zote wiki nzima imepita nakwambia twende hospitalini, unaambia huendi kuokota corona hospitali. Sasa amekuja amepimwa amepatikana corona. Hali yake si nzuri, hata kushuka kwa kitanda juu kushuka chini imekuwa ni shida.
The question on how effective vaccines are on these new variants is still of concern worldwide.
As we consider the performance of vaccines against variants or performance of vaccines against clinical disease, I think it's important to recognize that the serologic measures, the immune measures, the antibody measures of variants and vaccines are not fully predictive of what the performance of a vaccine is. So although there's a lot of evidence out there around the actual antibodies and their ability to neutralize a virus or a variant of a virus. There is no clear correlate between those measures and what to expect from protection against disease. For the products that are WHO EUL'd against the majority of the variants and for where we have data, those products are continuing to perform well, especially for the severe end of the disease spectrum, which is, of course, what we're most concerned about. So it's just a caution around these studies, which are important and contributory, that are immunology studies, but they don't actually give us the answer that we need about the performance of vaccines against the variants.
Long periods of isolation, lockdowns and closure of businesses has tremendous effects on the economy, social stability and mental health. However, with increased cases of COVID-19 and various mutations being reported, it is eminent that we practice social responsibility as we fight this pandemic. Saada Hassan for Health Watch, KTN News.